Gabe, it's Donna. I'm back to give you your nausea medicine. I'm just going to hand sanitize and I'll be right back, okay?
Okay.
Okay. Have you thrown up any more since I left?
Oh, thank goodness, no.
Okay, good. Just give me a second to get set up here. I brought a bunch of supplies with me. I need to sign in, first initial, last name, and password. This time I'm selecting patient room, and I'm going to select the yellow rectangle box next to Gabe's name and tap on that. Grab my scanner. Okay, Gabe, I'm just going to scan your band here. For safety reasons, I'm going to ask that you repeat your full name for me.
Gabriel West.
And what is your date of birth?
3505.
Perfect. So I see here that you have no medication allergies. Has anything changed since you've been here?
No, nothing.
Okay, wonderful. Just give me just a minute. I want to check your medication just a couple more times for safety. So I have Zofran ondansetron, 4 milligrams. Zofran ondansetron, 4 milligrams. His dose is 4 milligrams via G-tube every 4 hours as needed for nausea, and he has not given it. So I'm going to scan it. It turned green. So that completes this part of my second check, but the second check also includes preparing it for the patient. So there's a couple supplies that are in the room already. I have a Salem sump and a 35 ml syringe and a pill crusher. And the water, sterile water, is what we use to mix the medication with. And this has been opened. I see 2 expiration dates on it. So the first one is on the standard from the bottle from the manufacturer. Second one was on day shift. They opened it at 8:30 in the morning and signed off on it. And since it's within 24 hours, I'm able to use the sterile water. So I also need to assess the site, make sure everything is okay. All right, Gabe, I'm going to bring you up here a little bit first.
Okay.
I know I listened to your stomach a little earlier, but is it okay if I expose you? I'm just going to look at your stomach one more time and make sure that the G-tube is nice and patent before we go ahead and crush and give you these meds. And make sure your head is at a 30 to 45 degree angle. I want you to stay like that for a little bit after I give you the medication, okay?
Sounds good.
And I'm just going to pull your underwear down here a little bit since we don't want to get anything wet.
It's kind of cold.
Yeah, I'm sorry. You know what? I'm going to give you a washcloth. That will help in case if I drip anything. It won't be cold on your skin, okay?
Great, thanks.
I'm just going to put some gloves on. Okay, I'm going to tuck that in a little more. I'm going to take the tape off. I'm going to go slow and open it away from you. I don't want you to smell anything with being nauseated. But you know what? It looks nice and dry. I see no drainage whatsoever on this, so that is wonderful. I'm going to take a peek underneath. I'm checking for redness, swelling, or drainage at all around the site, and I see none. Looking good so far, buddy.
Good.
So I'm just going to grab a syringe, and I am going to open my water bottle. And again, since it was already opened on days, I'm going to move this out of the way. I'm going to lip it because I need to get any of the germs off of it that may have formed on the actual edge. So all the way around, I pour some off, and I'm just going to pour some in a cup so that I can pull it up. So I'm going to pull up 10 mLs. Again, I'm just flushing to check for patency, to lubricate so our medication goes in nice and doesn't stick to the edges. I'm going to make sure that I get rid of all of the air, so I'm not putting any air in him. And I didn't, because I got a little air bubble, I didn't get quite 10 mLs. There we go, perfect. All right, so I'm going to attach this before I unclamp it. I don't want any gastric juices coming out. All right, Gabe, this is going to feel a little cold, okay?
All right.
I'm just going to slowly infuse the 10 mLs of sterile water. It's going in really nice. I'm going to reclamp before I pull this off and close it. Lay it on my washcloth. This can go back into my container. Okay. I'm going to Take my gloves off and hand sanitize. One other thing that I could really prep would be my gauze pad to cover it once we're done. I'm going to support the packaging at the bottom. I'm just going to pull away. It's a clean procedure, but we try to keep the pad, the side that's going to touch him, sterile. Okay, so I think I have everything together and prepped. So now I'm going to do my third check, which is just my safety check for the medication. I'm coming over. Zofran, ondansetron, 4 milligrams. Zofran, ondansetron, 4 milligrams. His dose is 4 milligrams via G-tube every 4 hours as needed for nausea. This is PMs. It is now 18:20. So I'm going to put it in the PM column. I touched it, it turns green. And under the RN notes, I am just going to write patient called with nausea and vomiting. Okay, so that completes my third safety check, and I'm actually ready to crush my pill now at this point. Because this is a validation, we're actually going to use mints that are marked mints for G-tube and not open the packaging itself. So I'm going to take out my one pill. I'm going to open my pill crusher. I'm going to dump it in. So I open my package in without touching my pill, and then I can dump it right into my pill crusher. Again, trying not to touch the actual medication. I'm going to squeeze it until I'm all the way down. I'm going to back it up. I'm going to tap it a little. I'm going to go back. You're going to have to do it a few times. You want to make them as small of particles as you can. I'm going to take a peek at it. Oh, that crushed nice. I did get a little on the lid, so I'm going to scrape off as much as I can. Let's set that down. Now my sterile water, again, I had already lipped it all the way around so I can pick it back up. This time, though, I need to actually measure. I want 10 mLs exact. I'm going to get down to eye level to make sure that the meniscus is actually at 10 mLs. It is. I'm going to set it down. I'm going to tap my medication in. And again, you're going to lose a little bit in the bottom of the cup. Unfortunately, that's part of crushing meds. You're going to lose a little, but we're going to do our best with the tongue depressor to get as much as I can loosened. And then good. Okay. I'm going to take my time stirring this, supporting the cup. Sometimes it takes a while. That looks good. Okay. So I think I'm ready. I'm going to do this one actually by gravity. So I'm going to take the plunger out. Again, I'm doing it with a paper towel. I keep dripping here. I'm going to set this down because I still need to put gloves on. Almost there, Gabe. I don't need to use more water because we know that it's patent and still lubricated. There's still a little bit of the water in there. So I'm going to take my empty tube and I'm going to open up my port and push it in securely. I'm going to unclamp. Take my medication and I'm going to just pour it directly in. It's going to immediately start going into him. I don't want to go up too high because I don't want it to run in super fast. Make sure that I get it all the way in. And I'm going to just kind of pinch my tubing here, support my syringe. I'm pinching it because I want to directly pour my sterile water for flushing in. And again, I really want to measure to watch his INO. So I'm going to pour right to the 20. You can flush anywhere from 10 to 30 in a pediatric patient. So I'm going to unclamp and let it slowly run in. The higher I hold it, the faster it'll run. You doing okay, Gabe?
I am, thank you.
Good. And this time I want to make sure that it goes all the way in, all the way to the end. I'm assessing the tube to make sure that there's no medication, that I don't need more flush to get any of the meds that would be accumulated in the tube. I'm going to reclamp it. close my port and then wipe off any extra water that came off. I'm going to support it and I'm going to wrap it around. We actually put a cover on this, Gabe, just so that you don't catch it on your underwear or pull on it. It doesn't flop around and get in your way at all. Sometimes we use binders, sometimes we use gauze pad. I'm going to grab my tape. And I'm just going to secure this lightly. I'm going to leave the port out so it doesn't dig down into your skin. You can access it. Okay, at this point I can take my gloves off. Hand sanitize again. I'm just going to pull your shorts up a little bit. Put your gown back down. Okay. I'm going to lower your bed. Gabe, you have a call light in your hand here, buddy. If you feel like you're going to throw up again or just getting nauseated, I want you to call me right away. But I am going to come check on you in 30 minutes, okay?
Okay, thank you.
All right, and I'm just going to come over here and I'm going to certify that I've passed the medications. And I'm going to hit OK, that I really did it. And I'm going to go and rinse out my container and my med pill crusher, because again, they can stay in the room. We use those for 24 hours and put my lid back on my water. Put that on this bedside. And I'm all done.